Several health inequalities exist that affect the Detroit population. One of the biggest concerns with public health departments in the region is air quality and those who are uninsured. In this video, I'll discuss information that relates these two health inequalities with specific regions of Detroit and the average wages that exist here. Residents and workers in Detroit are exposed to high levels of various air pollutants. These include particulate matter, diesel exhaust, sulfur dioxide, and ozone. So these pollutants contribute to serious health issues, including asthma, cardiovascular problems, cancer, and in some cases, adverse birth outcomes. Detroit people in more vulnerable communities have been concerned and aware about air quality for some time now. According to Amy Scholes, a professor at Michigan Public Health, the negative impacts of air pollution on public health remain a top priority for Detroit residents and the local organizations. A University of Michigan study analyzed chemical air emissions and their impact on human health, and they found that Detroit is home to 5 of the top 25 most polluted zip codes in Michigan, with 48217 being ranked number 1. The uninsured rates in Detroit vary by income. So individuals with an annual family income under $10,000 have an uninsured rate of 19%. The highest uninsured rate, 26%, is found among those earning between $10,000 and $15,000, and those earning between $15,000 and $25,000 have an uninsured rate of about 20%. As the rate of income rises, the amount of uninsured goes down with that. Regions in Southeast Detroit experience the most health inequalities. As we've discussed up until this point, these populations experience the lowest wages, they have the worst air quality, and they're the most uninsured of populations in Detroit. And so as a result, this population has the most hospital visits on record due to asthma attacks in the state of Michigan, and they also have the highest rates of diabetes, heart disease, and cancer in Michigan. So with knowing all of these health inequalities that, people of the Southeast Detroit area are experiencing, what does the city plan to do to improve it? Well, in 2018, a survey by the University of Michigan's Detroit metro area found that only 8.7% of Detroit residents lacked health insurance, which is a significant decrease from 2013 when it was 19.4%. And this is, an ode to the implementation of the Affordable Care Act. And so in 2017, an initiative called the Clean Air and Public Health Education was launched, and it's a public health action plan with recommendations to improve air quality and public health, such as transitioning to cleaner fuels, increasing the planting of trees, promoting air filters in schools, homes, and businesses. And 6 years later, after 2017, the organization has made progress on several fronts, including expanding air quality monitoring, improving the air quality indoors, and influencing policies to address pollutants. Notable projects include assessing air quality in child-serving organizations like schools and daycares by upgrading the air filters, and as well as working with community groups to provide data on the health impacts of air pollution, which helps shape the decisions on truck routes, land use, and just different environmental policies in the city of Detroit. Another program called the Community Action to Promote Healthy Environments at the University of Michigan is a collaborative research partnership involving community-based organizations, health and government representatives, and also academic partners. And together, what they do is work to develop and implement a public health action plan aimed to improve air quality in Detroit and in turn improve the health of the population of Detroit people. And lastly, the Community Health Improvement Plan, otherwise known as CHIP, is a 3 to 5 year initiative aimed at addressing public health issues in Detroit. It's based on the community health assessment and other data that they collect. And so this plan focuses on setting priorities, coordinating the actions that are needed, and targeting and gathering resources to improve the desired health outcomes of the community as a whole. And so the CHIP plan involves engaging stakeholders in the community to create a strategic, data-driven plan and drive the changes that they desire. And so the ultimate goal of CHIP is to reduce health disparities and improve overall health in Detroit. So in conclusion, Detroit faces significant public health challenges, particularly in relation to the air quality and health insurance coverage, or the lack thereof. So vulnerable communities, especially in the southeast area of Detroit, are exposed to the high levels of air pollutants, which is contributing to systemic diseases. These areas are also experiencing high uninsured rates that we've discussed, which is creating an even larger barrier for them to obtain health. The programs CAPHE and CHIP are working to improve air quality, increase health insurance access, and reduce health disparities. But despite the progress that's being made, more collaboration and actions are needed to achieve a more long-term health improvement for those in the southeast area of Detroit.